Veterinary medicine. Thank you both for coming in.
Thank
and
you.
Thanks to our friend right here, too. You know, you may not take your dog for professional training, but everybody's got to take the dog to the vet and possibly to the groomer. That could be stressful, can it?
Absolutely, absolutely. Well, and that's where our Ready, Set for Groomer and Vet program really helps families learn that a little bit of training every day in the home environment using positive reinforcement versus correction training goes a long way.
Yeah, people don't realize how sensitive dogs are, do they? And tell me why corrective training doesn't work. I think I know, but talk to me about that.
Well, what we're looking at here is really building a relationship of positive associations. So dogs have a great canine communication system. So coming to the vet can already be pretty stressful for them. So we want to be able to read their body language, make sure that they're relaxed. And by using corrections, it kind of can make them more fearful, a bit more unsure of what's going to happen in their environment. But by learning that a treat, by being around the vet staff, such as Dr. Ballantyne, being in the grooming office, being touched by the groomer or the vet means that they're going to get a treat, has good outcomes.
You've got an adorable little dog. What kind of dog is she?
She's a Japanese Chin.
Pretty unusual dog, isn't it?
Yeah, she's beautiful, and she's 6 years old.
And she likes you a lot, too.
Oh, well, I'm very lucky to have known her for many years of her life.
Doctor, let's talk about some of the tips you all have for getting through this sometimes stressful event.
Okay.
Yeah.
Well, one of the things that Laura and I work on is teaching dogs to associate things like handling with their ears, with treats. If they only have that type of handling, let's say when they're ill, when they have an ear infection, their ear's going to be painful. So they're going to associate that type of handling with the pain, and they might try to run away or struggle or even become aggressive.
Certainly. And give me one more. I know rubber matting is one possibility. When you put them up on that stainless steel table, that's kind of scary, isn't it?
Yeah, and you know, that brings up a great point. If we look over here at Luna, the flat-coated retriever, she's learned that going on a mat has good outcomes.
Hey, Luna.
So in this scenario here, when we work with Luna, she learns that coming off the mat, she gets a treat, and then by going on the mat, Luna, home. Good. And then you can bring
very well trained.
Good girl, touch. Then what you can do is bring your yoga mat to the vet office and place it near the scale, have the dogs learn that, oh, I know that behavior, that's super easy. And by cueing really simple behaviors, such as hand targets, giving a paw, backing up, good girl, shake, then all of a sudden you can see them relax and go, well, it's not just about restraint and vaccinations all the time.
And doctor, these are things that we can do at home before you take them to the vet or the groomer, right?
Absolutely, absolutely. Yeah. And then you can even take your dogs into your veterinary clinic for happy visits. So they can go in when they don't need an examination or they don't need vaccinations, and you can bring your mat, you can run them through their quick and easy training. They could have a great experience.
How much training has Luna had?
Oh, goodness. Luna's been in training probably for about 5 years now. She's been training with us for about 2 years now.
Well, you know what? She's very laid back. She's very calm right here. And, you know, being in a television studio can be fairly stressful for dogs as well. What other tips do you have, Doctor?
Well, one of the good things that Laura is showing right now is she's teaching Luna to target the ear cleaning bottle so that ear cleaning solution doesn't just come out to be squirted in your ears. Ear cleaning solution comes out and she gets to touch it with her nose and get a treat.
And she knows what it is, and it won't be a foreign object when you actually need to use it.
Absolutely. You could do the same thing with toothbrushes. You could do the same thing with nail trimmers, anything that you need to use.
And I love the idea of using the sort of a dummy pill to teach them. Tell me about that.
Absolutely, yeah. One of the things that we have found to be super helpful is we get the gel capsules from the local health food stores, and we put some peanut butter in them, and we actually then click and treat the dog for swallowing the empty pill that has the peanut butter. So when it's time to actually take, this is one of Luna's actual supplements right here. So we're going to go ahead and offer it to her today. And then as soon as she swallows it, she gets a click and treat for swallowing her actual daily vitamin supplement. So we're not having to...
Good old positive reinforcement.
Absolutely.
Always works. Better than anything negative with a dog. They're sensitive, then they, you know. Well, thank you. I think these are some wonderful tips. To get more on the Ready, Set for Groomer and vet dog training, just log on to abtconcepts.com. Thank you both for coming in.
Thank you.
And thanks to our little guys here as well. If you want to watch this segment again, just log on to WGNTV.com/midday and we'll take you there. Thank you, Luna.